Hello, YouTube family. Hello. Welcome back to my channel. So, if you're watching me for the first time, please like, share, comment, and subscribe. Okay. And if you're my returning subscribers, you're also welcome. Okay. So now, guys, before I told you that I am an educationist. On today's video, guys, I promise I'm gonna be taking you on a patient safety. Okay, so when you hear the word, I'm not gonna take much of our time, okay, so that I don't make this video boring for you. So when you hear about patient safety, what comes your mind? Huh? As a nurse, what comes up in your mind? This is patient that is betrayed to you or that is handed over to you. How will you, as a nurse, ensure the safetyness of this particular patient under your care? Okay, now, guys, remember, in a nursing approach or in a nursing profession, you can flash back your memory about nursing's role. Introduction to nursing. Some of the nursing's role. Nursing's, if you can remember, one of them is a caregiver. A nurse is seen or regarded as a caregiver. He's regarded as an advocate. He's regarded as a counselor. He's also regarded as an educationist. Okay, so they play so many roles in the life of a patient. Okay, now in this particular patient safety, okay, which is your main centered focus or your main centered attention, okay, one of the things you need to uh, ensure in the safetyness of your patient is infection control. Okay, educating your patients the need, okay, to educating your patients on the needs for, personal hygiene. It matters a lot. Hand washing, you know you know making sure that he doesn't contaminate other clinical or medical diseases around the hospital, because there are hospital illness or hospital infection that patient doesn't come to the hospital with, but as a result of their taking up treatment, if proper education is not given to the patient may probably end up going home being infected from the hospital. So personal hygiene, teaching the patient the needs for personal hygiene is very necessary, as long as you are dealing with patient safety. So guys, the next one again is what you need to put into consideration that is very much important is data collection. Right, when you know the need of data collection, that's getting a full information of the patient that is under your care, it will go a long way in assisting you on the need and way by which you can do what you can carry out this. It can help you or go a long way to ensure that you achieve a maximum health goal you want in the life of that particular patient. So at the collection of data matters, and in collection of this data will help you to know the kind of treatment you want to give to that your patient. It will also help you to know the kind of drug, okay, that he has to do what he has to use. Okay, so this is very, very necessary. Data collection is very, very important. Now, guys, another thing, because now you are dealing with patient safety nets, another thing that will come in your mind, because in this patient safety net, sometimes doctors and nurses are having lots of lapses. I mean, will I say sometimes they may get tired, fatigue, and some things bothering them and all the rest of them. So they neglect little issues, and that could also be harmful to the patient they are taking care of. So it is advised to the nurses that whatever you're going through, make sure that you put them aside and make sure that your patient is your main priority, your main centered focused attention, because having that little negligences around you could be very, very dangerous and could be unsafe for that particular patient under your care. Let me tell you why. For instance, time of administering of drug. Maybe you're tired or busy, gisting, talking, and the time to administer drug to your patient, that time elapses. Tell me, you have already endangered that particular patient, because the time meant for the drug, or the physician has ordered for it to be administered, so that the patient can get healed quickly and be discharged, because that is your main focus and that is your major aim, so that he gets better and you'll be fine and you'll be happy, and the physician as well. And those lapses, maybe forgetfulness, fatigue, and all the rest of it, you forget to administer the drug at the right time, it could affect, the healing of that particular patient. So you see that the patient is automatically unsafe, and that could result to another problem. So sometimes another negligence, sometimes again, is fear. Some of the hospitals where nurses work, the box or the supervisor, sometimes they are very, very harsh, and it kind of, sometimes they are being frightened, and sometimes some nurses get afraid of them. Okay, and sometimes it could be as a result of bad handwriting of the doctors. Some of them, they like to abbreviate some of the drugs, and you being the nurse, because you are not a physician, so some of the handwriting might be complicating and confusing. So it is advised, since this particular patient safety net is your main centered focus, don't be afraid. In a mindful mind, in a mindful way, ask question. Sir, please, maybe this drug I can't understand. What is it? What is the name? And all the rest of it. You try to make sure you understand and ask questions when necessary, so that you don't make errors on your side, because some of the error you can make can lead you to prison as a result of this particular profession. So you need to be very, very careful. That is why this particular patient safety net is encouraged, is very, very necessary, as long as nursing profession is concerned. Okay, guys, so the next thing again, guys, you will like to put into consideration is uh, prevention of patients falling. Sometimes they would like to do things on their own. That is why observation is very, very necessary. Just like I said, when you be able to identify the patient, you'll be able to know the kind of drug and the right time, the right route, whether they should be given intravenous or through IV flu or through intramuscular, depends. Okay guys, depending the one the physician gave you. Okay, so that will go a long way in helping you. And prevention of patients fall, sometimes they'll like to do so. It is your duty as the nurse to make sure that the beds by which they lay is properly safe. If it is the one that needs the lifting of the handle or in order to protect them from falling, you can do that. Then you go back, and time to time you try to go there and check on your patient. Is very, very important. Okay, so the next one again, um, under the patient safety, is blood transfusion. Guys, in this, remember, we are dealing with patient safety net. In blood transfusion, you know that you need to make sure, like in blood transfusion, like when someone wants to, you want to infuse blood in a patient, you must, the person or the donor must properly be checked. You must make sure there is match. Okay, that the blood, there is a blood, that the blood we are infusing matches with the patient's uh, blood group as well, to avoid problem. Okay, because when you infuse the wrong uh, blood group to your patient, it is a very big problem. The, it could cause something very, very dangerous. So checking the blood group of the patient and the donor is very, very necessary before you do what, you infuse your, or you try to make your transfusion. Okay, so the next one is communication. Guys, communication is very, very, very important in this particular patient safety net, because if you are not a good communicator, you can't educate. Okay, if it is some patient who is going through emotional and everything, there is nothing to give to the patient. Okay, so you must be a very good communicator in order to ensure you achieve this particular, you achieve your aim on this particular patient safety purposes. Okay, so you must be a good communicator. So remember that nurses are seen, the main major aim of a nurse is to is to give a holistic care, irrespective of who the person is, where he's coming from, economic background, religious background, cultural background. Is this, I mean, you need to do what? Make sure that you give the whole total care necessary for that particular patient. That's what it is saying about. And you cannot do that when you have, when you are, when you have a poor communication. You must be a good communicator. You must be a very good attentive listener. It's not when communication is not maybe when you begin to nag, you begin to, being angry, a kind of stuff. You need to be sober. You need to be sympathetic. It's one of the roles. That's one of the kind of characteristics that is being seen on a nurse. Have to be sympathetic, they are sober, they are humble. That kind of qualities must be found in you. Okay, so when the patient is nagging and you too, you are nagging, you can't actually get the right information from the patient, because some patients, sometimes they could be nervous, but it's the major thing you need to do as a nurse is to do what? Pay good attention, talk less and listen more, so that you'll be able to identify or to know actual problem he or she has, so that you can give an action, give and a potential, you give the right treatment or the right, care necessary for that particular patient. Okay, so the next thing again is alarm devices in the hospital. Guys, is one of the things that is necessary in some clinics and hospitals, because once it's triggered, okay, it alerts all the workers or team nurses or team workers in the hospital that something is really wrong, and they could come and be of help at that moment. So these particular devices are very, very necessary, even though it is disturbing, because some patients, when it is triggered, some of those devices can last for 24 hours, 72 hours, depending, and you will know that is really, really disturbing, especially a patient on a critical condition. It could be noisy and all that. It could make them uncomfortable and all what. So this is all you need to know in this particular courses, guys. Okay, I'm gonna stop here. So far so good. So if you have any question or anything confusing in this particular patient safety, okay, that you are not getting it well understood, please kindly give me message on my comment section, and I will quickly reply you. Okay, bye bye.